Good morning, guys. I messed up. I came in my robe to drop off Haiti like I do every day, but I need to stop by the grocery store. So I have my slippers on, I have pajamas on, and I need to stop by it. But I need to because today is a big day. Christian's getting sedated to do dental work, so he needs some jello in his body. Oh, that cart better not hit me. And their Christmas edition. How embarrassing. So we just arrived at the dentist. Christian is going to be sedated today through the IV. So you guys know Christian is autistic and nonverbal, but he struggles with sitting down, letting them open his mouth and look in there. So for his routine dental care, we do have to sedate him. It's been at least 5 years since we did this, right, Ben?
It's been a while.
Last time we did this, I think he was 3 or 4. So it's been a while, and we just want to make sure everything's good. So x-rays, routine cleanup, and anything else that they see that needs to be fixed, they'll fix today. And we also went ahead and told them to do the sealant. So that is like a protector on his molars and the tooth right before his molars to protect that. Try like a kind of extra protection in regards to cavities and things like that. So fingers crossed everything goes good. He's had no food, as you can tell. He's so sad. I'm just kidding. He's had no food for over 8 hours. He had some jello right before. So we're actually on time. Let's roll.
Let's go.
So they told us to bring a blanket with us, probably for comfort. And he's got his little teddy that was not a teddy. His little plushie, cookie monster. We gotta go the other way, Christian. Let's go. This way, let's go. ¿Qué haces con lentes? ¿De quién son? You took them off. Christian, ya está. Go play. Sebby, don't throw it on the floor. You just put him to sleep. He did good. So now we're waiting. My wild child's over there.
Sí, bajo 170.
Despierta. Christian, as soon as we said popsicle, said, huh? Sorry. Huh? And for the first time, opened his eyes. You want some? Yeah. You go by yourself.
He's awake. We got a live one.
I wonder if you can bite it, Christian. Maybe not, huh?
Does he have his eye open?
I saw one eye. Papa. Christian. There you are. You gotta wake up to go home. All right, so it has been 7 hours since Christian's dentist appointment. And unfortunately, everything wasn't great. So he had 3 cavities and he had one that was too big, right? It became infected, and they gave us a choice of either a root canal, wait and see how it looks because the x-ray was showing like a chance that it was already infected, or pull it out. And with Christian being nonverbal, with him not sitting for x-rays, he could be in very much pain, and we assumed that it's leg pain, so that was not a risk that we were willing to take. The other one was a root canal, and for that one, it was a big no, because when you're under 12 years old, they can't sedate you to do that. You have to be awake for the root canal, and there's no way that Christian would be okay with that. So our only choice was to pull the tooth. And that was a big choice, and it sucks because they come out and they tell you what's wrong, and then they're like, all right, so what do you want to do, right? It's like you feel like,
that's the hardest
give
part.
me a second, I don't know.
It's like, what do you want to do? You want to pull it out? You want us to work on it?
And on top of that, every 15 minutes after the hour of them sedating him costs us $150. So it's like dun 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 dun. And I was telling Hugo, like, oh, let's decide, hurry. It was like ticking time bomb, huh?
Yeah, but at the end of the day, we feel we made the right decision.
Yeah.
When they pulled out the tooth, the dentist said that it looked like it was already past.
So it was red, swollen.
Yeah.
There was signs that they always look for infection. And she said that thankfully when you pull the tooth, the infection pretty much is done, so he doesn't need antibiotics. But
So in other words, she pretty much said we did the right decision, and Jazzy and I were thinking she's probably just saying that to
we
make
were
us
like,
feel better.
how do we know that it was infected or not? Like, we were only going based off what she's telling us. But
Yeah.
I told Hugo,
Well,
all we can do is make decisions based on our knowledge that we have at that moment.
She also showed us the X-ray, and on the X-ray, it shows that it's a little darker towards the gum, and the darkness indicates infection.
Because there was a chance that it wasn't super bad and we pulled a tooth for no reason. But we didn't want to risk really bad tooth pain with him not being able to tell us. That's the biggest thing. Hugo had a really bad tooth infection, and he said it was really bad pain.
Yeah.
And Christian?
So I recently myself went through a tooth extraction, and it was also infected. And I got to taste some of the pain of a toothache, and that's extremely painful. So this was back in November, and so now I have a gap there as well that I'm trying to get a
implant
on it. And Jasmine actually has
don't put me out of business.
What I mean,
as you can see, damn.
She has one, I have one, and now Christian has one. We'll see who's next.
Stop. So it sucks because Christian already doesn't love having his teeth brushed. We feel like we failed a bit. We could have done so much better. It's like the things that you are nervous about for years, and it comes to reality, you know. Mm-hmm. And we just have to be better at brushing his teeth at night, especially even if he's fighting us, even if it's late. Like, we have to make sure to get in there. And the one that they extracted is like the molar, so it's back here. So even when we brush, he doesn't. It's not perfect. So we have to make sure to get back there.
Well, I mean, if you want to be somewhat like on the positive side, is like now there's gonna be a big gap so you could get in there good.
Yeah.
No.
Yes. But the biggest worry that I was telling Hugo is my worry after they extract it, because there's the chance of infection. He didn't leave. Usually they put a gauze to control the bleeding and like kind of seal it. As soon as he woke up, they said that he like removed it, and he keeps messing with it with his tongue. I go like this. He can't gargle or anything like before. When you get an instruction, they tell you to gargle with salt and water. They didn't tell us that here, but we know that that's usually what they tell you.
Well, the reason they said he didn't have to do that is because the infection wasn't on his gums.
Yeah. He's coming back. We can't leave him alone. Like right now, he's around us, but we can't leave him alone because all of a sudden he'll randomly be trying to pick at it. The good news is that he has this. It's like they call it like a spacer, a rubber band thing that they cement on the tooth. It can still come out if he messes with it too much, but it's supposed to keep it secure, and it kind of works as a barrier for him not to like mess with it too much.
Well, the purpose of it is as he's getting older, his jaw he's still growing, and we don't want to reduce that space in between his teeth. Mm-hmm.
So because there's a chance that the molar could kind of like start shifting downward, the one that's behind there. So they want to secure that spot and make sure that there's still space, because he has to wait, if we choose to get an implant, until he's 18, until his mouth and everything has kind of shifted and is in place. So he's gonna have that for a while. But I feel like it sucks because for kiddos with severe disabilities that don't allow x-rays and stuff, you need to make sure, I'm trying to see these, you need to make sure to kind of do sedation at least every year and a half to 2 is what she said. And I feel like I don't want to blame them, but we weren't kind of like told that, you know. It's kind of like an option, but they don't say like you really should, right? And Hugo and I, when we were sitting down, we were both like, man, if only we had done this maybe 6 months ago, if only we had done this a year ago, we could have saved the tooth. But I mean, the if onlys are not real, and it is what it is. This is life. So now we know. Hugo advocated for Christian and asked the dentist if there was a way she can give us the little film that you use with the biting thing that you put on your mouth so that they can do an x-ray. So they gave us 2 of those, and she said just practice biting down on it and holding it for 3 seconds. If we can do x-rays, at least, like if they don't have to put them to sleep for x-rays, that would give us a better understanding of like, okay, everything looks good. And if there ever was an issue, that's when we would put them to sleep to do the work, right? Yeah. So hopefully
in the near future, he'll be able to do x-rays with us practicing at home.
Yeah.
And just be able to find answers quicker if something's going on.
Yeah, because this is not cheap, and that's probably why we waited so long. And because insurance doesn't cover sedation unless it's like an emergency, and this technically isn't an emergency to them, Christian. So to be very blunt with you guys, we paid over $1,000 for the sedation was $750, and they charge you $150 after every hour. So actually, it was $600 for the first hour, and then every 15 minutes after, it's $150. And then on top of that, our insurance covers the molars in the back, the adults, but they don't cover other teeth. And for the sealant, the sealant is the cover that they put to protect. So in the future, if there's a better protection against cavities. So we paid for that as well. And then I think that, and then the extraction hopefully is going to be covered. They didn't charge us yet, but we'll see. But yeah, it's a lot of money. It's a lot of money, but I definitely he needed it, huh?
Yeah. So we do have a tip when it comes down
Oh,
to
yeah.
trying to do sedation by IV.
In general, like blood work.
Yeah,
Yeah, it's a trick that also works for IV in the dentist.
Yeah, it's very, very, I think it's a very good tip. And
The anesthesiologist also says she might be trying to use this
Yeah.
herself moving forward for other parents.
I always get that everywhere we go.
Everywhere we go.
I'm going to start doing that. I'm going to start doing that.
But at first, everybody's like, what?
So the way it works here, I'll demonstrate it for you guys real quick. Christian, stand up, please.
He's going to be like, no.
Stand up, please. Stand up. Oh, boy. So this is how we do it. Mom is the nurse, and then I'll sit on Christian. And by me sitting on him, I'm controlling his entire body, so he can't stand up and he can't be kicking people because I have
And
control.
then me,
and
the
then
nurse.
Mom, the nurse, would be holding the arm here.
And then somebody else would be doing the thing.
Yeah, and someone else would be putting
the needle.
The needle, you.
That way, there's no trying to fling your body and kicking like in the past. And it worked because before that, she said, kiddos will struggle. There's a chance that he might struggle. We can try a muscle relaxer first, but they wake up a little bit more angry and a little bit less quickly. So we decided to try this first, and it worked. So if that's a tip for you guys, hopefully it'll help you guys. Try that. Try to sit on your child. Do you put all your weight on him?
Yeah.
Damn.
Well, I mean, he's 150 pounds.
Yeah, Christian's
190, 180.
So, obviously, figure if your child is little, maybe just put some of your weight, enough so that they can't really move their legs as much. Christian doesn't feel overwhelmed by it. Christian, but he has an avocado.
So if it's a random person,
no, it can't be a random person. It has to be family for sure. Now we have to wait a week to go back and see how everything goes. We try to keep his fingers out of his mouth, and that's hard because he's a biter and he's a thumb sucker. So we've just been like, Christian, no, trying to get him to not put his hand in his mouth. Maybe we should get a fidget for him. Now we're gonna chill, keep an eye on him, and hopefully everything continues okay. He hasn't cried since. He cried when he got out of the when we were walking out of the dentist office, when we were wheeling him out to the car, he started crying a little bit, but we gave him Tylenol, and they also gave him some medicine in the IV, and hopefully he does okay during the night too. And then Christian's, even with that tooth extracted, he's still trying to eat tortillas and all this stuff that he never even eats. Like, he doesn't even, he's over here like, give it to me. But we're going to keep an eye on Christian, and he's a trooper.
So today, his first meal was, hey, boy. Today, his first meal was, here you go, you get one. You get one. You get one. I get one. Today, his first meal was caldo de pollo. He got 2 servings because that was his first meal of the day. And we were doing the fasting with him since we didn't feel comfortable eating, knowing that our son's going to be starving. So we tagged along with him.
So everybody's first meal was around 6? 5:30?
Like around 5:30.
5:36.
Yeah.
Now I'm ready to just watch a movie and chill.
It is 7:30, and we are ready to wrap it up for today. I took the day off.
Thankfully, because imagine me calling you at work, babe, I want to take his tooth. What do I do?
Yeah, I was thinking like, oh man, that would have sucked if I wouldn't have been there. And you have to make all those choices, and like, oh, am I doing the right choice?
And then, like I said, it's a timeline to it, a time crunch.
Yeah.
But yeah, that's it. Hopefully, my tip is if your kiddo is not letting you do the X-rays and all that stuff, really consider at least once every couple of years a sedated appointment, because
it could be bad.
It could be bad, and
The
Like
pain,
if your
the
son is
pain.
if your son or daughter is like Christian, they might not even show that they're in pain, you know? I think the biggest reason why we went to the dentist and did this, because we were postponing because of the money, is because we noticed that he had a little dark spot. And then right before that, Hugo had his tooth pain, and Hugo was like, no, we need to, like, that's
Yeah.
not, we see a little dark spot, and what if he's in pain? So that's when we were like, all right, no, we got to do it.
Toothache ain't no joke. And I know a lot of you guys know what I'm talking about when it comes down to toothache.
Yeah. So hopefully we can do a better job all around with dental care. Even if it's hard, we got to do it. But yep, that's what happened today. So we'll keep you guys updated on that and other things. Thank you guys for tagging along, and we'll see you in the next video. Bye.